are about to listen to the Dr. Dahlia Show. Sassy, stimulating medical talk radio. Any medical advice Dr. Dahlia Wax gives on her show should not be substituted for an actual visit to your medical provider. And now, here's Dr. Dahlia.
Welcome back to the Dr. Dahlia Show, 1-877-DOC-DALI, 1-877-DOCDALI. So I can't stand mushrooms. I will rarely put a mushroom in my mouth. I don't like the taste. I don't like the texture. I know people say, yeah, but like a portobello mushroom, it's like meat. No, it's not like meat. If I want a burger, I'll have a burger. I do not want a portobello mushroom sandwich. The only time I've been okay with mushrooms is in mushroom ravioli. For some reason, if it's really like diced up and minced and really full of flavors so I don't taste the mushroom, I might eat it, but I just don't like mushrooms. Unfortunately, California health officials are warning people to not eat wild mushrooms because they've been linked to, there's a toxic form that has been linked to 3 deaths. Fox News is reporting that these Deathcap mushrooms are often mistaken for safe edible lookalikes. Apparently, the mushrooms are called Amanita phalloides. They contain toxins that could cause amatoxin poisoning. Amatoxin poisoning could lead to severe illness and death. Sadly, these poisonings cause severe liver damage in both children and adults, resulting in 3 deaths, 3 liver transplants, and 35 hospitalizations. Now, this is as of January 6th. So I'm not sure, what happened. Was it somebody brought these to a party? I don't know. But the California Department of Public Health has warned the outbreak was linked to consumption of wild foraged mushrooms and urged Californians to not pick or eat wild mushrooms at this time. Even if you cook them, or boil them, or dry them, or freeze them, they could still be poisonous. The California Poison Control System has identified cases across Northern California and the Central Coast, spanning regions from Sonoma to San Luis Obispo between November 18th and January 6th, and affected individuals. Of these 3 who died and multiple hospitalizations ranged anywhere from a 19-month-old to 67 years old. Now, officials think that the very wet winter that we've had in California might have allowed there to be this overgrowth of the toxic mushroom. So what is amatoxin poisoning? So symptoms include nausea, vomiting, diarrhea, abdominal pain, dehydration, and this could occur within 6 to 24 hours after ingesting the poisonous mushroom, according to the California Department of Public Health. Now, according to Dr. Lauren Shawn, who is an ER physician and medical toxicologist at Northwell Health Phelps Hospital, Sleepy Hollow, New York, told Fox News Digital, you might not get symptoms for the first 5 or 6 hours, and that's just by nature of the breakdown of the toxin in the stomach. Now, for some people, they might resolve within a day or 2, but for others, it could cause serious or fatal liver damage. That could occur within days of eating the mushroom. So they say after the initial stomach issue subsides, the toxin could continue to invade the liver cells and stop them from making RNA, ribonucleic acid. Well, your body needs, the RNA, and they need, the protective proteins. They need the structure and they need the processes to go unfettered. So according to Dr. Shawn, it says it takes some time for the toxin to actually damage the cell, which is why people don't show up with liver failure until a day or 2 later, which always makes it difficult because whenever we're examining you and we're like, okay, well, what's wrong? What do you have? What did you eat? Most people don't remember what they ate. I don't remember what I ate 5 minutes ago, let alone 2 days ago. And so it's really, really important if you're not feeling well to get that looked at. They say amatoxin damages many types of cells in the human body, but especially liver cells. They say because the damage caused by the Deathcap mushroom, the liver is no longer able to function properly. Now, for those of you who have listened to other previous segments on the show, without a functional liver, making very essential cholesterol or making very essential proteins and things for the body, it also filters out bad things. And so if your liver is not functioning properly, you can go through liver failure and you could die. So we do not have a widely available rapid test to detect amatoxin poisoning. Usually we clinicians have to rely on, well, what did you eat? Did you pick it? But we have to ask. That's the thing. If medical students are listening to the show, you need to ask, were you playing around the grass and did you eat any mushrooms? Sometimes people forget. So if, let's say, you go, Dr. Dahlia, I think I did eat a mushroom. I think I did accidentally pick one and put it in my mouth, or I fell on the grass, and when I rolled my face, a mushroom fell into the mouth, whatever. Talk to your primary care physician. Talk to a liver specialist. Make sure they check your liver function test. Luckily, that's an easy blood test for us to look at your liver function. And then we could always scan the liver and look for issues. Now, if you have any leftover mushrooms, they say bring them in or take pictures of them, because many of you don't know what, let's say like with the spider, what bit you? Well, don't, try to catch a live spider that just bit you. But if you do have anything that has caused you harm, if you could package them up and bring them in so we could see them, that's ideal. So California Health Agency is now telling you to avoid foraging wild mushrooms. They say the Deathcap mushroom can look to the untrained eye like many common and non-toxic mushrooms. So another thing I want to leave you on the segment with about this is many people will call into telemedicine saying, I have food poisoning, I need an antibiotic, or I need medicine for nausea, and we do want to make sure that we control the nausea. We want to make sure that we give you fluids. We want to make sure that you aren't decompensating. But if you have food poisoning, that implies there could be a toxin that you ingested. And that toxin, whether it's E. coli or like the hemolytic uremic syndrome, there's things that the toxins can do that could sadly really, really hurt you. And so it's not just, well, I'm going to throw it all up or I'm going to have diarrhea. If you think you have food poisoning, you definitely want to make sure that you get seen right away and let us evaluate, because that toxin could be extremely, extremely toxic. That's why we call it a toxin. Also, we are on the lookout for viral, bacterial type things that could cause gastroenteritis. So I hope this helped. Just do not be eating wild mushrooms. Don't go away. We'll be right back. 1-877-DOC-DALI, 1-877-DOC-DALI.
Let's face it, guys, we're living in times where the truth is becoming more suppressed and censorship is increasing at an alarming rate, especially on social media platforms. It's Clyde, and I want to tell you about a safe and secure digital playground we put together just for you. It's Aftermath.media. You get access to thousands of Ground Zero archives and podcasts, along with our private social media groups with your basic membership starting at only $7 a month. Each subscription includes tech support, access to the RSS feeds, along with our own chat room and Telegram channel. In addition, the premium membership includes research study groups, webinars, a document and movie library, a live video stream of Ground Zero, a monthly Zoom chat with me, and other bonus content. Be sure to check out our yearly specials as well. Sign up today while you're thinking about it. Sign up at Aftermath.media. Again, that's Aftermath.media.
Hey guys, it's Dr. Dahlia. Fantasy football season is coming, but sadly, too many of you are taking the bench while the country takes part in one of the most exciting and lucrative industries out there. Don't know how to play? Well, huddle up and listen. Paul Kalikas and I have written a fantasy football pocket guide for beginners. This book walks you through the basics and shows you how simple and lucrative joining or creating a fantasy football team can be. Read our fantasy football pocket guide for beginners found on Amazon, or follow the links on X and Facebook. That's Fantasy Football Pocket Guides for Beginners. Don't be left out.
Increase fuel economy up to 7.9% with Hot Shot Secret Gasoline Extreme, the solution to maximize your engine's performance and fuel economy. Whether you're driving a sports car or a daily commuter, Gasoline Extreme is specially formulated with PEA to deep clean. Don't settle for an average driving experience. Upgrade to Hot Shot Secret Gasoline Extreme and go further on each tank. Order now on Amazon or HotShotSecret.com. Hot Shot Secret, powered by science.
Welcome back to the Dr. Dahlia Show, 1-877-DOC-DALI, 1-877-DOC-DALI. So this article caught my eye. Health insurance is now more expensive than the mortgage for these Americans. And this was published in the Wall Street Journal, where health insurance is more expensive than mortgage. Now, I don't know why the media is only covering this now. We have been paying since Obamacare thousands upon thousands of dollars each month for insurance. For some of us, there's been subsidies where the government is giving some of those thousands of dollars for your plan to the insurance company, not to you. But I don't understand why this is breaking news. This is something that we have been saying now since 2009 for 17 years. We've been saying that the health insurance is ridiculously expensive. And so Wall Street Journal says millions of Americans are starting to see their monthly health insurance bills rise. They say many of those facing the most dramatic dollar increases are middle-income Americans who buy health insurance through the marketplaces set up by the government's Affordable Care Act, known as Obamacare, which was a cluster and a seventh on the way that was designed. So, being that expanded subsidies for those insured have expired, because the only way that works is if the government keeps, gravy training insurance companies. There's no incentive for the insurance companies to lower the rates. And so they give us an example of Lenny and Mandy Wilson. They're 47. They live in Charleston, West Virginia. They were able to get health insurance for $255 a month last year for a low-end ACA plan. Now, I'm glad that people who struggle financially are able to get cheaper health insurance. I've never seen that price, obviously. I've been paying thousands of dollars a month, but I'm glad somebody got to benefit from that. Late last year, they learned that their bill was going up to $2,155 a month, which is nearly triple their monthly mortgage payment, and they pay for their mortgage $760. So they said the Wilsons each squeezed in one last checkup before the end of 2025 and have decided that they're not going to buy insurance. They're planning to put the money they used to spend on their premiums into an emergency fund. They will avoid any preventative care and hope their modest savings can cover any medical costs. Now, they said that the ACA plan they purchased was not the greatest plan, but it did give them some coverage and made sure they wouldn't go bankrupt if something happened. So now they're a little bit nervous and, living precariously without health insurance. And one of the reasons why they have a big increase is because they earn combined $110,000 a year. And that is more than 400% of the federal poverty level. Because you would say, well, if they can't afford health insurance, they might be able to qualify for Medicaid. But if they're making six figures combined, even though that's not a lot these days, that doesn't qualify for Medicaid. So Congress, during the COVID pandemic, expanded the subsidies for ACA plans to many households if you earned over 400% of the poverty level. So if let's say your salary was $62,600 for a single person or $128,600 for a family of four, that gave you a lot more wiggle room. So middle income earners without good options for, shall we say, employer-based health insurance would then go to the Obamacare website. Nonprofit Kaiser Family Foundation estimates that about 10% of the ACA enrollees or the Obamacare enrollees in 2025 had annual incomes above $400,000. That equates to 2.5 million people. So where I'm kind of upset with this is we were promised by Obama that the insurance would be cheaper, that we would be able to keep our doctor, would all be able to get insurance. And instead, people are seeing $2,500 premiums. They say on this, the Wall Street Journal, the typical enrollee with subsidized ACA coverage is projected to face a 114% rise in premium bills if they stay on the same plan. And KFF projects, or the Kaiser Family Foundation projects, an average of $888 a year in 2025 to $1,900 a year in 2026. The dollar increases are even higher, they say. So this is really, really confusing me, because if we have fewer people who want to buy the crappy insurance on the ACA, you have a consumer base, and a huge one. And you also have in those individuals people that don't qualify for the subsidies. So you've always had them. And many of these individuals just did without, or they bought the barest insurance plan, because Obamacare forced insurance companies to pay for pre-existing conditions, physicals, which I agree with. But then these bare basic insurance plans covered barely what they needed to in writing. And so most people are like, no, I got to pay this out of pocket. And so they're not using the insurance. You have a huge consumer base. If I was United Healthcare or Blue Cross or whatever, I would be like, let's attract these individuals. Let's come up with a good plan. Make it, what is that? Geico, pay for what you need? Or is that the Emu? Yeah, pay for what you need. Let's get you a plan that works for your budget. And we're going to work with you on this. It's been 17 years. But instead, they've been relying on the ACA subsidies. So everybody's blaming Republicans for the ACA subsidies expiring. But the ACA subsidies were always a false security net, a false safety net. You are relying on taxpayers to give money to the insurance company as they keep increasing their rates without being asked. The ACA said there had to be transparency, but I am telling you right now, these insurance companies can say, well, we bought whiteout, we bought this, we had to get new furniture, the air conditioning, the rent went up, this went up. Oh, trust me, they could pad their expense reports and go, you see, we really should have raised rates by $1,000 a month. So when Trump said maybe ACA is going to die on its own because we're not going to be giving insurance companies the money, why don't we give money to patients so they could use that towards their premiums? Now that starts to change everything, because if the insurance company wants you, they're going to have to lower their rates. Now, the first thing the insurance company is going to do is like what the colleges did. Well, how much did things get expanded for? How much? You could now borrow another 20 grand, another 50 grand. Oh, well, that's perfect because our rates just went up another 20 or 50 grand. So what the insurance companies are going to do is go, okay, well, how much are you getting? How much cash do you have? And if they say they only gave us an extra $1,000, they're going to have to work within that. And they can work within that. But all you're going to now see is, well, the subsidies. People can't buy health insurance. People can't buy health insurance. If I was a health insurance company right now, I would get a hold of all those individuals that can't afford the crappy insurance plans and work with them on getting them a better deal. Another thing, too, is I would go through Costco, Sam's Club, and say, look, we will give your members a cheaper, like almost insurance, employer insurance sort of plan and premiums. And then people could, through their Sam's Club or through their King Soopers or through their Wawas, or if there's something they belong to and have rewards with, they are able to, as a block, buy health insurance and get it cheaper, just like Chamber of Commerce does, or employer health insurance. There's so much wiggle room. There's so much, and the only reason why this can actually happen is insurance companies are going to stop getting the gravy train from the government. So they can't be charging you $2,500 a month, like many of us are paying for health insurance, because they're not going to get it. So if they want to still stay afloat, they're going to have to provide cheaper plans, not crappier insurance, but plans that we could afford. And I just don't understand why it's taken this long. And it's just because the government just keeps saying, well, we got to do Obamacare subsidies. And the average American, even if they got that plan, they still had a high deductible. They still had higher copays. So they were underinsured. They might have gotten a card in their wallet, but were they going for their pap smears? Were they going for their prostate screens? Were they getting moles removed that could be precancerous? Many of them have not been using their insurance. So they say Democrat and Republican negotiators are working on now to reach a deal for a short-term extension. But what President Trump said is, why don't we just give the money to the consumers and not the insurance company? The sooner that happens, this could actually force health insurance companies to go, you know what? If nobody's buying our $2,500 a month plan, we're going to have to maybe make it $1,200 a month. Or maybe we're going to have to come up with a better deductible. But the plans that we are trying to sell that nobody wants to buy, and now the government's going to give us money for, won't give us money for, we're going to have to change our tune. So I think this could be, maybe as much as I was like, oh, we got to extend the subsidies temporarily. Maybe the problem will solve itself, like Trump says. And insurance companies need to be listening. They need to be on top of this. 1-877-Doc-Dolly. Don't go away. Hi guys, Dr. Dahlia here. Addictions can sneak up on us and come in many forms, whether it's drugs, alcohol, sex, video games, porn, or something less obvious such as food, internet, or shopping. Addiction can seem innocent at first and then evolve into an insurmountable evil. In our book, Addiction Basics, Caitlin Kalikas and I dive into the common addictions and provide tips for identifying and preventing these before they sneak in and take over our lives. Addiction Basics can be found on Amazon or my website, drdahlia.com. Check it out.
Carl Amari here to tell you about our newest website for old-time radio lovers. It's 100radioshows.com. At this site, there are 5 old-time radio shows waiting for you to download free as our gift to you, and be sure to browse the additional 700 old-time radio shows available to you for 70% off by using the promo code RADIO at checkout. This is a limited-time offer, so log on to 100radioshows.com. That's 100radioshows.com.
Dolly 1-877-DOCDALI. So remember I told you guys how to save money on your taxes, because a lot of the expenses you spend can be written off if you hit 7.5% of your adjusted gross income. Anything beyond that, you can write off. So for example, let's say you make $100,000 a year and you spend $10,000 on medical expenses. 7.5% AGI is the cutoff, so anything above that could be tax deductible, meaning $2,500 can now be written off with your taxes. Well, another thing that many people don't understand and they don't take advantage of are their Medicare benefits. And we're being told that billions of dollars in Medicare benefits go unused each year. Now, what are they talking about? What are some of these benefits? Well, one is your over-the-counter benefits. So apparently you can buy non-prescription health-related items at no extra cost if you have, let's say, Medicare Advantage C. So let's say you had to buy cold and flu medication, allergy medication, aspirin, antacids. We're being told that that could be, as a part of Medicare Advantage, a part of the allowance that you get. I think you get anywhere from like $50 to $100 per quarter. It's not a lot, but that adds up. That could be up to an extra $400 a year. This also includes sunscreen, toothbrushes, toothpaste, denture care, bandages, blood pressure monitors, thermometers. Let's say you need, depends, for incontinence issues, pads, smoking cessation products, hemorrhoid cream. These are things that could help. Now, I don't believe toilet paper or deodorant or shampoo or cosmetics get covered, but apparently there are prepaid cards that you could use. You know how SNAP benefits are a card, for food and et cetera. You get this type of card, I believe, with Medicare Part C or other insurance plans that you could use for these items. And the allowances, I guess, are distributed either monthly or quarterly. And some plans might allow rollover of unused funds. Some might, if you don't use it, you lose it. But that's interesting how there's this sort of access. So I'm looking at this article called MoneyWise, and they say there's an app that might help you figure out what sort of you can use as a part of your Medicare. Let me see what they say here. It's called the Chapter OTC app. It's founded by Kobe Blumfeld Gantz. I haven't downloaded it. I'm not Medicare age, but I'll do a little research on this. But according to this article, MoneyWise, it promises to help people find and use their available OTC benefits for free. Apparently, he created this app to help people seamlessly navigate their OTC benefits after he watched his own parents struggle to make the most of their Medicare Advantage plans. So apparently, many people enrolled in Medicare Advantage plans will qualify for this. As of 2023, over 87% of plans offered an OTC benefit of some kind, yet 70% of these Medicare over-the-counter benefits remain unused. With around $5 billion left in unspent over-the-counter benefits each year, I think it's because many people don't realize that they could use it. And it is confusing. I think the nature of this has always been confusing so that the money doesn't get spent. But listen, I'm your radio doctor, so I may not be your physician, but as your radio doctor, I want to make sure you're not spending any more than you need to spend. And if that money can go to your prescriptions, which you might not be spending appropriately because you're trying to cut and save. Why are you buying Tylenol? Why are you buying bandages? Why are you buying hemorrhoid cream? Why are you buying, certain things? I'm also wondering if even vitamins get covered and certain supplements get covered with this. So it's interesting how this app will be able to, help you. In fact, some plans, and now it does depend on your Medicare Advantage plans. Like, let's say some of you are trying to use healthy foods, things like that. There might be opportunities for your Medicare Advantage benefits to cover that as well. 17 million older adults are now considered economically insecure. I even think that number is even higher than what this article states. And they say for many, especially those on limited fixed incomes, obviously tapping into this can save you some bucks. So they have an example of Lynn Fitzgerald. She's a stroke survivor. She recently discovered that she could tap into benefits, and she gets $120 quarterly. So that's almost $500 a year. She has been able to use that for night lights. How many of us trip over the cat in the middle of the night? That'd be nice to have a nightlight, bandages, dental floss, and vitamins without having to dip into her own budget. So according to Chapter OTC, this app, they say the average benefits are around $400 per year per enrollee. Either way, that's $400. I guess you put in your plan, you put in your zip code, your insurance carrier, and then it tells you. I like the fact that there are these things out there that make things easily. I don't do a lot of apps because I'm still not very tech savvy, but you're telling me I'm going to save money? I think I want to do that. So, the moral of what we've talked about the last few weeks on the show is there's a lot you could save if you do your research. And I've been there where somebody says you could make money on this, or you could do this, and I feel like it's scam. Or sometimes the rebates, like applying for a rebate. If you tell me that there's a rebate and I got to do paperwork and I got to hope that they pay, you know how many rebates I've applied for? And the money never comes back. And I, so now when I hear, well, there's a rebate, I'm like, well, that doesn't sell me. But being able to get, these extra funds, I think is important. Now, if let's say you do use these sort of funds for toothpaste, for over-the-counter medications, you cannot then write it off. So the medical tax deductions I spoke to you about, those are for things that you haven't gotten reimbursed for. And there's so many things we talked about, your glasses, your contact lenses you could write off. If you had LASIK or PRK, that can all be written off. If you have mileage, the mileage, I think it's 20.5 cents a mile. Every time you go to the eye doctor or to the physical therapist or even to the pharmacy or to the doctor, that mileage you could write off. Do you document your mileage? No, I'm sure there's an app for that. But I think you should, because 20.5 cents a mile, everywhere I go is about a 10-mile drive. So, I mean, you're making bucks. So these are things we just need to be a little bit more aware of. Now, cough, cold, and flu season, I got to tell you, I walked into a Walmart. I mean, I walked out of there spending about 100-some bucks. You'll be careful with some of the things you're buying. I would still make sure a lot of these things are doctor recommended. I've had patients with rectal bleed using over-the-counter, hemorrhoid preparations. Don't use those unless it has been recommended by a medical provider. If you're bleeding, you could be putting the wrong thing there. Now, we've had parents with their child reacting and having, like I just had a patient where the child, after her basketball game started swelling in the lips, rash worsened. Benadryl might help, but make sure you still take them in because there's exercise-induced angioedema and other things where after activity or just with changes in temperature or allergen exposures, some people could swell, the difficulty breathing, lip swelling, things like that. So these over-the-counter medications, if you remember, are there to help you if a medical provider recommends it. But I think a lot of people are self-treating, which is something we, don't like it. Listen, I don't mind if you go to Dr. Google, but keep in mind that for those of us who are doctors, when we evaluate you, we're comprehensively looking at all things. So for example, let's say you sprained your ankle. So you're like, I'm going to take a whole bunch of Motrin. Well, our job is to make sure your kidneys can handle that, your stomach can handle that. Are you on a blood pressure medicine that should not interact with Motrin or naproxen? So, let us do our job. If you don't have a medical provider that can see you, you can always call into telemedicine. But if telemedicine says, look, I want you to get some Flonase, or I want you to get some Benadryl, or I want you to get some Claritin, or I want you to get some Tums, or I want you to get some over-the-counter PPIs, I got to tell you, all that stuff should hopefully get covered for you. And I think you will definitely like saving money. All right. Ooh, see, I'm teaching you guys something. 1-877-DOC-DALI, 1-877-DOC-DALI.
Hey guys, it's Clyde. We've had a lot of requests for Ground Zero merchandise, so we put together an online store with a big variety of high-quality items. I'm really excited to let you know about these things. We have a lot to offer you and your loved ones. In addition to our regular apparel, such as t-shirts, beanies, hoodies, and hats, we've expanded our product line with posters, flags, aprons, mugs, and a whole lot more. We also have Ground Zero collectibles along with a limited edition of items like a Clyde Lewis canvas portrait, a Ground Zero embroidered jacket that will certainly make for great gifts and for interesting conversations with family and friends. And we now offer publications such as Ron Patton's book about mind control, MK Zine, and back copies of the official magazine of Ground Zero while it was in print. Paranoia, the Conspiracy Reader, also coming in 2023, are updated and revised books that I've written. There's a secure and easy-to-use shopping cart for your purchases. So shop today at our official store by going to groundzeromerch.com. Again, that's groundzeromerch.com.
Hey, America. How tired are you of mainstream corporate media's biased narratives and manipulated news? Their dishonesty and attempts to influence this generation have been exposed, put on display for anyone who's even half paying attention. But the New American Magazine has been an honest source of news and commentary for over 50 years. This is your opportunity to receive the stalwart of principled journalism at a deep discount. Picture a beautifully published magazine arriving at your doorstep twice a month, packed with insightful stories written with integrity. It's also available digitally on the New American's mobile app. Get up to speed with intelligent coverage from a freedom perspective. Right now, for a limited time, the New American is available to radio listeners at a 25% discount on a new subscription. Visit thenewamerican.com/radio25 and receive 25% off. Subscribe today at thenewamerican.com/radio25.
All right. We are back on the Dr. Dahlia Show. Thank you all for tuning in. 1-877-DOC-DALI, 1-877-DOC-DALI. So sadly, millions of Americans struggle with pain. Knee pain, hip pain, back pain, migraine, tooth pain. And we've been struggling on what the fine balance is to control one's pain, but not have them become addicted to narcotics. Now, I've noticed for me, and I've been very, very blessed that I have the kidneys and the stomach lining to tolerate it, that ibuprofen, post-surgery, post-hysterectomy, right? Post-biopsy, post everything I've had, that did better for me than the narcotic. But what if somebody doesn't have healthy kidneys? What if somebody suffers from ulcers and they can't take that medication or an allergy to it? Being in pain is not easy. And I know many people who struggle with pain can't stand when somebody who doesn't struggle with pain says, well, we need to stop pain medicine use and doctors need to stop prescribing it, etc. If anybody has ever struggled with anything, with pain, it's frightening. I've been in pain after car accidents and surgery, and it's frightening. But I probably can definitely relate to a lot of you who suffer from migraines. When a migraine comes on, narcotics never work for me and migraines, because once the medicine wears off, the headache is even worse. It's bigger and badder. So I'm afraid to use anything like that. But for me, my go-to is like Excedrin migraine. And it's interesting because I have to pack it with me wherever I go. I don't get migraines often, but the idea of, the pain is starting and it's going to get worse, the anxiety could set in. And I'm not an anxious person, but I could will other pain away. When my knee hurts, I could go, I'm not thinking about it, I'm moving on, and it goes away. If my hip hurts, if my back hurts, if I had menstrual cramps, I'm like, I could just bear right through it. Not with the migraine. For those of us who struggle with migraines, we know that if we don't jump on that sucker, that could be a problem. So here we are as consumers and as patients trying to figure out what it is we need when we have this whole sort of new landscape of, nope, sorry, you're just looking for pain medications. Or you're like, but look, if I could get something early, I could stave it off so I don't need more. And I have said for the longest time, we need more education and more options in terms of medication that's non-opioid that people could use. Because the anti-inflammatories or the COX-2 inhibitors or some of these other ones are not always able to be received by patients who are allergic or have other issues. So we're still in dire straits as it pertains to pain control. And sadly, this opioid crisis is rising. Is it because people can't get the medication from their doctors, so they're getting it off the market on the street? Is it because they're in so much pain that they're killing themselves, and that's why we're seeing suicides go up or overdose deaths go up? We have a problem. Well, this might be an answer. This might be a huge, huge answer. So we're being told that Vertex Pharmaceuticals just got FDA approval for their drug. It is a new pain reliever, the first one in more than 2 decades that have gotten approved. It's called suzetrigine. It's a 50 milligram prescription that you take every 12 hours, and it's sold under the brand name Journavx. 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 I don't know how to pronounce the sucker. I still mispronounce penicillin sometimes. Journavx. And it is a non-opioid analgesic therapeutic class that I think it works on the sodium channels that could modulate pain. And it prevents the pain signal from going to the brain. They say government surveys show that analgesics or medications that control pain are the most commonly prescribed of drug in hospitals. And 80 million Americans are filling prescriptions each year for medications to treat these. Now that number is a huge gross underestimation because a lot of people don't have health care or they have high deductibles. So they're getting their pain pills cash elsewhere. So that 80 million is an underestimation. That's a lot of people in pain. Suzetrigine is the first new painkiller approved since Celebrex came on the market. Now, Celebrex is a non-steroidal anti-inflammatory drug, a COX-2 inhibitor. It was approved in the late 90s. It does great, but a lot of people who have severe pain, they say the Celebrex or the meloxicam doesn't cut it for them. So pain isn't just a one spot. There's multiple parts of the body that are within your pain system. And pain is supposed to protect you. If you burn yourself on a stove, that is teaching you and protecting you from burning yourself again. You're touching something hot or touching something cold, or you then know how to protect yourself, or to protect yourself. And so if we could address the electrical signal where the tissue is being hurt or the damage is being hurt before it gets to the brain and the dopamine starts to demand narcotics, etc., they say this prevents the pain signal nerves around the body from firing in the first place. Now, it's amazing that something like this could exist. I don't know much about the complications of it, but it works by closing one sodium channel that conducts only pain signals. Because I know a lot of people go, wait a second, I don't want things numb to the point that they don't work. Well, if it can be that selective and figure out which channel to address, they're saying it only affects pain signals. They say there have been many false starts along the way, this is according to CNN Health, to finding a drug that could block one specific sodium channel. This suzetrigine's approval means now, depending on the patent, other companies could now hopefully jump on that. There were 2 clinical trials that included 600 people. They used the suzetrigine after abdominal and foot surgeries, and they found that it controlled pain better than placebo. So placebo is basically a dummy pill, a fake pill that won't hurt you. But in order to see if something works, if somebody knows they're getting something, they might buy placebo going, oh, this works. So what they have to do is make you blind, not blind in terms of really blind, but figuratively, we do a double blind study. There's single blind and double blind. Double blind is also so there's no bias of the person giving you the medicine. You know, so like somebody giving you a placebo, if it's a single blind, they could be like, here's your medication. Yeah, and somebody could pick up on, okay, I'm getting the fake one. But if it's double blind, the person who's giving you the medication, they don't know what they're giving you. They don't know if they're giving you the drug or the placebo. I mean, obviously, they know it's one of the 2 drugs. So it's not like they're going to give you, a celery stick. So that allows for there to be less bias. And they found some interesting data. They said about as many people said the suzetrigine reduced their pain by at least half after surgery as those who took Vicodin. Now, Vicodin is acetaminophen, Tylenol, and hydrocodone. Now, the study was not designed to see how much better this is compared to Vicodin, but it was to see how it worked. And so they said the suzetrigine reduced pain by 3.5 points on a scale of 0 to 10. Now, reducing pain such as that was still considered significant. There was another study where people had back pain, and they saw the suzetrigine. This is really hard with the lisp. I have a lisp, so I'm sorry. I'm struggling with this one. Suzetrigine reduced pain by about 2 points. Now, I know some of you are like, Dr. Dahlia, really? 2 points, 3 points? I need something to knock me out. We're going to have to change our attitudes with pain. And I get it. My migraine, nothing is effective against my migraine unless I think it knocks it out. I get that. But we're going to have to reevaluate how we're addressing this, because we're not going to find perfect. And I'm telling you right now, people who take narcotics, they don't go pain-free. They end up still having baseline pain. We're trying to minimize so you could function. Like cough suppressants. We want to minimize your cough. You might still have a cough, but you'll still be able to function and not pee on yourself. So some of us pee on ourselves when we cough. 1-877-DOC-DOLLY, don't go away.
Looking for an easy read that can actually help secure someone's future? Pick up a copy of Mark Falter's book, Common Sense Income Strategies. For the past 30-plus years, Mark has helped thousands of hardworking Americans secure their financial future by using strategies that continue to create wealth, whether the market is up or down. Strategies that will make perfect sense once you take the time to read this powerful book. Common Sense Income Strategies brings to you what Mark has been teaching in person and talking about on the radio for decades. It's not rocket science, it's a pretty easy read. You've worked too long and too hard not to see the fruits of your labor. Common Sense Income Strategies is available now on Amazon or by calling 866-764-2635. That's 866-764-2635. Common Sense Income Strategies by financial fitness show host Mark Falter. Secure your financial future today.